And we turn now to Vermont Independent Senator Bernie Sanders, who joins us from Burlington. Good morning to you, Senator Sanders.
Good morning.
We are 86 days away from the midterms. Tuesday in Minnesota, progressive candidate Peggy Flanagan, the current lieutenant governor who you have endorsed, is taking on a more moderate candidate, Angie Craig. Do you think this is going to be a similar dynamic to Michigan, where this was a tight race?
I think it's going to be a tight race. I hope very much that Peggy wins. I think what we're seeing in Minnesota, Margaret, in Michigan, and all across this country is that people understand that we're living with an economy that is rigged. You have working families, 60% of our people living paycheck to paycheck. People can't afford groceries, housing, healthcare, basic necessities of life. And at the same time, they're seeing the richest people in this country become even richer. People are tired of the status quo politics and establishment policies. They want real change, and Peggy Flanagan is about bringing about real change, standing up to the big money interests. There is a reason why the super PACs and the billionaires are flooding Minnesota with all kinds of money. Same thing as Michigan. They don't want somebody to stand up for the working class in Minnesota.
But you still are confident Flanagan's going to pull this off?
I'm sorry?
You are confident Flanagan will win?
No, I'm not confident. I think it's going to be a very, very close race.
Okay.
I think she is being outspent 7-1. And under those circumstances, it's tough for anybody to win. But she has a good ground game. I know she has a lot of grassroots support, and I'll do everything that I can to see that she does win.
Okay. I know that you haven't gotten involved in many governor's races with the exception of Maine, but Democratic Socialist Francesca Hong in Wisconsin is expected to win her Democratic primary. There's been some attention to some of her social media posts recently, but she has this platform of free childcare, state-run grocery stores, more health care subsidies. She wants to raise income taxes on millionaires. Some of this does seem to align with your platform. So I'm wondering, why don't you support her? Is some of what she supports too extreme for you?
No, raising taxes on the rich, making sure that everybody in Wisconsin or America has health care as a right, sounds quite reasonable to me. Look, we have a limited number of races that we can be involved in. Most of my focus on is getting people elected to the United States Senate, getting people elected to the House of Representatives. So with one exception, we have not been involved in a governor's race, and that's somebody who I've known in Maine for many, many years.
Who is now running for the Senate in Maine?
That's right.
That's right. There was, in Michigan, this historic turnout, but the race was closer than many had expected. Dr. Abdul El-Sayed, former public health official, he did win by just 1 point. Since that time, President Trump has said he's happy that he won because he's going to be an easier candidate to defeat, basically, is what he's implying. And The Economist has polling showing the party's victory probability has fallen to 48%, putting Democrats' chances of controlling the Senate at 49%. Obviously, you want to resist that projection. What's your strategy on a coalition here?
Well, I look at that analysis a little bit differently. Margaret, in Michigan, in my view, Abdul's victory was one of the most extraordinary victories in modern political history. You tell me, have you ever heard of a candidate winning who was outspent 9-1? $60 million in billionaire-funded super PAC money came into that race, half from AIPAC, and yet he managed to win. Now, I think what we are seeing all over this country, from coast to coast, is that working people are sick and tired of being the only major country on earth that does not guarantee health care to all people as a human right. Yep. They're sick and tired of massive income and wealth inequality. Who believes? Now, I know we don't discuss this much in Congress or in the media, but nobody that I know thinks it makes sense that one man in America today, Mr. Musk, owns more wealth than the bottom half of American society. Who believes that we should sustain and maintain a corrupt campaign finance system where billionaires are undermining American democracy? The
Yeah.
reason that we're going to win is people, whether you're conservative or Democrat, tired of the status quo and of the massive levels of inequality that exist right now.
You have written a letter that was shared with us to Democratic leaders in Congress and the DNC, calling for public funding of elections and for the party to prohibit political action committees from participating in primary races. I understand your principled argument here. However, Democrats have a financial resource problem that is very real as compared to Republicans and their war chest. Why would the party disarm?
We're not talking about disarmament. We're talking about within the Democratic primary, not in the general election. The campaign finance system today is corrupt. In Michigan, what you had is AIPAC spending $30 million in the Democratic primary trying to defeat Abdul. They lost. And now they're saying, we're going to support this guy, Rogers, who was a Republican. So what you are seeing is it doesn't matter whether you're a Democrat or Republican, these special interests, and it's not just AIPAC, it's the AI people, it's crypto, they will take over the primaries and try to get their point of view through, get their special interest accomplished, regardless of which party is. So to me, it is insane that the Democrats would allow somebody to come in, an entity to come in, that will then, if they lose, go into the other party.
Okay, we need to talk more about this, but I have to pay our bills here and take a break. So please stay with us, Senator Sanders. We'll be right back. Welcome back to Face the Nation. We return now to our conversation with Senator Bernie Sanders. Senator, before the break, we were talking about your concern about super PACs and their involvement in primaries. You said you don't want Democrats to unilaterally disarm. Just to clarify, you highlighted $60 million poured into Michigan to defeat Dr. El-Sayed. Half of it came from AIPAC. They are now saying they're going to support the Republican in the general, which you also pointed out. Are you okay with Democrats accepting PAC money in the general but not in the primary?
Look, in the world that we live in, until we get rid of Citizens United and get rid of super PACs and move to public funding of elections, that is the reality. You can't allow Democratic candidates to be outspent 50-1. But it is a corrupt campaign finance system, and Democrats can take charge of what takes place within their own primaries right now. General election can't, but within primaries, Democrats can get super PACs out. That's what they should do.
I want to focus in on AIPAC in particular, because Dr. El-Sayed campaigned on this platform of cutting unconditional aid to countries, not just Israel. He said Egypt, the country his parents immigrated from, cut it to Jordan, cut it to Pakistan, cut it to Saudi Arabia. He listed a number of countries and Israel. His mention of Israel and the war in Gaza has drawn a lot of criticism. President Trump said it's hate of Jewish people. When you speak, I know you are very specific in referring to the right-wing government of Benjamin Netanyahu, the prime minister. Would you advise Dr. El-Sayed and other progressive candidates to speak in a way that doesn't invite as much criticism?
Look, I think Abdul has run a brilliant campaign, and he's more than capable of making his own political judgments. But I think, Margaret, all over the country, people are deeply concerned that when we have so many problems at home, we have people sleeping out on the streets, people can't afford health care, we are spending billions and billions of dollars on the right-wing extremist Netanyahu government, which has done horrific things to the Palestinian people. Many people, experts, including myself, consider what's going on there as a genocide. And I think whether you're Democrat, Republican, conservative, progressive, we don't think that we should be continuing to fund an extremist government like that.
Some MAGA candidates also make that argument, but this is a real attack line being focused on Dr. El-Sayed in particular.
Well, let's be clear. I mean, from Trump on down, you have Trump, who is in many ways an authoritarian type, and he is going to go after El-Sayed because, for racist reasons. I think their first announcement after Abdul won is He is a Muslim, and we're all supposed to hate Muslims. You know, these guys have nothing to say about the major crises facing our country. All they could do is appeal to racism. We're communists, you know, all kinds of nonsense like that. But I think that at the end of the day, the people of Michigan understand that the status quo is not working. We need a candidate like Abdul who has the guts to stand up for working class families. This guy wrote a book. He's a doctor on Medicare for all.
Yeah.
The current healthcare system is broken. We got to guarantee healthcare to all people. Abdul understands that and will help us move in that direction.
Senator Sanders, we'll leave it there. We're going to talk about healthcare next with Dr. Jay Bhattacharya. So we'll continue that part of the conversation. We'll be right back. We're joined now by the director of the National Institutes of Health, Dr. Jay Bhattacharya. Good morning to you, doctor.
Good morning.
And we should mention you're also helping to run the CDC until the new director is sworn in as well.
Until next Wednesday, yes. Until
next Wednesday. So let me ask you about a number of things that I think people at home are worried about, particularly around the food supply. The cyclospora outbreak linked to iceberg lettuce from Mexico is now in 15 states. There were 2 deaths this week due to it. Yesterday, USDA issued an alert for a range of products that may have salmonella, including meat and poultry. 27 states are affected by salmonella, possibly linked to jalapenos, but cilantro, red onion, avocado also listed in a CDC notice. Albertsons, a grocery store, just recalled some items. There's risk of salmonella in eggs in Texas, according to the CDC. And then you have the screwworm outbreak affecting beef. This is overwhelming for someone going into a grocery store right now. Why do they seem out of control?
Well, the cyclospora outbreak is larger than in normal years. I mean, normal years there actually is a cyclospora cases. I'd say the 2 deaths that you mentioned, they happened in late June, early July, before we identified the source. And so folks that are listening, you can rest assured the CDC and the FDA are working hard to trace back exactly where these outbreaks are occurring from, intervening with the sort of suppliers to make sure that they don't, and doing recalls to make sure that the disease doesn't, condition doesn't spread. I mean, it's tough. You go to a grocery store, you buy lettuce, and you say, okay, can I buy the lettuce?
Yeah.
And what I say to folks listening, we're working hard to make sure that the contaminated sources don't get onto the shelves. And if you're worried, you can buy the lettuce, but make sure you wash it carefully. Don't eat the outer leaves. And if you're really worried, just cook your vegetables.
But we're not hearing from the FDA. I mean, should there be a restriction on imports from central Mexico right now? It seems like a lot of things are tied back.
Yeah, I mean, I think the key thing is that when we find a contaminated source, we intervene. I can't speak for the FDA, thank God. It's just the NIH and CDC. But I can say that the folks who I have worked with at the FDA they're a great team of folks that are tracking back and finding the source of these outbreaks. And for cyclospora specifically, it's complicated because for technical reasons, it's more difficult than if it was just a bacteria to find the exact source. But they've done a great job finding it, and they've been cooperating with the CDC team that I've led the last few months to try to identify the source. And it's what we know now is because of that hard work that's gone on.
But there are also a number of other health issues, including measles cases now at their highest level in 35 years. The CDC says only 10 U.S. states have measles vaccine coverage rates above the 95% threshold in the prior school year. That is so key because that is, as you know, a marker for basically a way to stop transmission, herd immunity. Do you believe that the federal government needs to make a really full-throated push to tell parents, go get your kids vaccinated with the MMR vaccine?
One of the first things I did as CDC director, I think it was back in February of this year, was that there was a big outbreak in South Carolina. And I went on, I don't know if TV is the right word, but I went on camera and I recommended that the best way to end the measles outbreak there was to have their parents vaccinate their kids for measles. Yeah. And the outbreak has now ended in South Carolina, in part because of that. There's been a lot of outbreaks, not just in the United States, but around the world. Yes. And a lot of that has to do with sort of a collapse in sort of public trust in a lot of science, public health measures that occurred during the pandemic for reasons we can discuss. For me, the most important thing is to try to regain that trust.
Right, but why not? You can have TV ads. You can have something that's more of a national push. It was notable last week that Secretary Kennedy went on television and did say parents should get kids vaccinated for measles because it's effective at preventing infection roughly 97% of the time. That was a change for him. He has not always been that clear, as you know. Why not blast that across the airwaves of America?
I mean, I think that I've done my best to try to do that. Every time anyone's asked me about vaccinating for their kids for measles, I say exactly that. That the best way to protect your kids from measles is to get the vaccine for measles.
This country's going to lose its measles elimination status in November.
As did Canada, as did Mexico,
but
as did
that's
the
not
UK.
accessible, right? For gold standard science.
But I think the thing is if you look at the actual what's happened, like there's specific states where you've had these outbreaks. Big outbreak in Texas, which has now been addressed. Big outbreak in Arizona and Utah that's been addressed. South Carolina that's been addressed. Now what we saw was an outbreak in Virginia, again coming down sharply in now Pennsylvania. It's specific communities of people that are the highest risk that we have to focus on, as well as the broader sort of message that it's important for children to be vaccinated for the measles if we want to address the measles outbreak.
Well, that's why I brought up herd immunity, because it puts everyone at risk, right? Not just people. But on this issue, you were down in Atlanta this past week. This is 1 year since that horrific shooting at CDC headquarters. Officer David Rose was honored this past week. He was killed last year protecting CDC employees from a gunman. And we should note he was a combat veteran, a United States Marine who had just graduated 5 months prior from the police academy. 3 kids left behind. The shooter was motivated by misinformation about the COVID vaccine. That is why he shot over 100 bullets into the windows of the CDC. Is enough being done to counter this kind of misinformation? I
mean, I should start with, I got to talk with Officer Rose's wife a few months back. Well, one of the first things I did is to honor him and his sacrifice in protecting the people that work at the CDC, the amazing people who work at the CDC, was we renamed the street that leads into the CDC after him, and it was a really nice event. I'll tell you, the thing is, I want to focus my attention on Officer Rose because I think the shooter did was horrific. And I think you can talk about why shooters do things, but really fundamentally.
Well, his father said he was brainwashed about the COVID vaccine and thought it was making him suicidal. That's what
Margaret,
his
the thing is, it's like to talk about the
shooter
puts the emphasis on somebody who's. I think we shouldn't be putting our emphasis on.
No, I am on misinformation about. Vaccines.
I think the key thing is there's a loss of public trust in public health that happened in part because of a lot of, frankly, even on this network and on other networks, there was a particular single point of view put across during the COVID pandemic about how, that led to things that really did cause harm to people. The school closures is probably the number one thing. This
is not a productive line of claims. We covered COVID in depth on this program like no other Sunday show did.
I'm not blaming you specifically. What I'm saying is, you want to talk about misinformation. The kinds of decisions and sort of the public sort of face of public health during the pandemic led to many people losing trust in public health.
The Trump administration officials.
No, I mean like Biden. So Biden, for instance, censored me. The
pandemic began under the Trump administration.
But just so we're clear, the Biden administration censored me. Right? They sent out direct attacks on people who disagreed on the COVID, on sort of whether the COVID vaccine stopped it.
RFK Jr. called the COVID vaccine the deadliest vaccine ever made. That is misinformation, and we're not being clear about that. And I think that is dangerous. Wouldn't you agree,
Margaret? Because the Biden administration censored people and said, "Look, you can't even talk about COVID vaccine harms." Yeah, and I'm talking about why you have the kind of distrust that's led to the kind of problems that we're talking about earlier in public health. That distrust was not caused by President Trump. It wasn't caused by Bobby. It was caused by a lot of sort of really fundamentally, but often spread by the government itself regarding natural immunity, closure of schools, closures of mask mandates. People lost their jobs because of these vaccine mandates that didn't make any public health sense. So if you want to talk about public trust, you have to embrace that fully, right? You can't just talk about it in a narrow political way.
I'm talking about a shooting at the CDC and an officer you said you just went to honor. That's what I was talking about. You're talking about something else entirely.
You're trying.
I also asked you about shoring up public health in the vaccine.
What you're talking about is you're trying to blame the shooting on Bobby.
No, I'm not. I'm reading you what his father said.
No, what you're saying, what you're implying is that somehow
I'm
the lack of public trust.
not talking about him. I'm talking about your visit there. And is enough being done?
I think it's
Let's
really
talk
unfortunate.
about, since you want to restore public trust, tell me what you're doing now, because the Washington Post and Bloomberg reported the White House is preparing an executive order on vaccines and autism. What is it going to prescribe? What is it going to do? Why are we seeing another announcement here when I know you are launching research into a plethora of issues that are contributing factors potentially to autism? Why would the White House be saying only look at this thing?
Well, we'll have to ask the president about specifics of the executive order. I'll tell you what we're doing.
Do you think that's restoring trust in vaccines?
The purpose of you can ask the president about the executive order, but I'll tell you what the focus of the president has been. You don't know about the executive order? I won't be able to tell you specifically what's on it because I don't think it's done yet, but you can ask the president about it. What I can tell you is that the president cares deeply, as does Bobby, about the rise in autism. I know you do as well. There's so many families around the country that have had, have faced the issues of this.
And
right?
they want real information.
And so I, as NIH director, have been focused on making sure that we have science that addresses that very complicated question about why we've seen a rise in autism. It's not going to be a simple answer. Last year, I authorized something called the Autism Data Science Initiative. That we're going to have a big early results from it in a couple of weeks from the dozen and more scientific teams that have been funded to look at this, with a mandate of thinking very broadly, not just genes, not just environmental exposures, but potential interactions. We don't know. If you ask me as a scientist, do I know why we've seen this rise in autism? I'll tell you, I don't know the answer to that question. And the fact that it gets so tied up with, okay, is it vaccines, not vaccines? What it does is it sends a signal to the scientists that if you work on this topic, you're going to get destroyed if you get the wrong answer. Yeah. I've tried my hardest. The way you build public trust is allow people to talk and think without that kind of political overlay. I've tried my very hardest as NIH director to allow that to happen.
Which is so key for science, which is why I'm asking you why the president putting out an order specifically focused on what seems to be preconceived notion, how that wouldn't be undermining.
You're jumping ahead. I don't know exactly this executive order, neither do you. So it's not,
Well, it's interesting that you don't. My colleague Matt Gutman here at CBS asked you last week whether you think vaccines cause autism. You said you don't know for certain. You said there isn't evidence that any vaccine causes autism, but you also don't have evidence that vaccines do not. Parents are preparing to send their kids back to school.
I just want to be very clear what I actually said.
Please be clear. Yeah. Should parents trust that they can go vaccinate their kids when their doctor tells them to do so for them to go back to school?
I think that parents, for most kids, especially for the measles vaccines, the DTP, all the standard childhood vaccines, it's very important that parents vaccinate their kids. As far as can they feel confident sending back to schools, I just to push back some, it was a tremendous mistake to cause parents to fear about sending their kids to school during the COVID pandemic. The kids were better off in school. We shouldn't be scaring public.
I'm talking about what people do now. It's August, about to be September.
Yeah, but
kids
Margaret,
are going back to school.
you're
I'm not
talking
about 2020. I'm talking about 2026.
We're talking about the why
clarity
people have
from the federal government
just so we're
and
clear,
the top health official.
If you want clarity, let me give you some clarity.
Please.
The reason why you have this problem of public trust is because what happened in 2020 has not yet been addressed.
Can these parents trust you and the recommendation that they should get their kids vaccinated?
The parents should trust me. I'm giving my recommendation. I've vaccinated my kids. I don't think that I think if you want to protect your kids from these sort of preventable diseases, yes, you should vaccinate your kids. But it is even more important that these kids go to school. Mm-hmm. That in no way, shape, or form should this show or any other show like it perpetuate the idea that sending their kids to school is worse because there's going to be some health risk there, when it's just not true, right? If you want to protect your kids from those preventable diseases, vaccinate your kids. I've been very, very clear about that. But it is a mistake, and it contributes to the lack of public trust if you sort of fearmonger around, if you send your kids to school, well, you might be around unvaccinated kids. That's a tremendous mistake, right? If you vaccinate your kids, you can protect your kids from those risks, whatever they are. In any case, it's better to send the kids to school because that's how you keep kids healthy.
Yes. We want to send our kids to school.
I'm not, but now addressing what happened in 2020 is part of that. I mean, you want to say why there's this loss of public trust, you have to really wrap your arms around that.
But you trust the science and the health workers and the vaccines now, is what I understood you were saying. And so that is the message that I
trust the
think
science. I've looked at the scientific evidence, and there's lots. I personally have made decisions for my family around those lines too. So
that's good to know. Thank you. We're going to leave it there because I know we're running out of time. We'll be back in a moment. Federal officials say water systems in at least a dozen states have been breached by cyber attacks, and that the list could grow. Joining us now is CBS News Homeland Security and Justice correspondent Nicole Sganga to tell us more. Nicole, I've heard you talking about it this week, and it was really fascinating to me. We had up a map showing all the states affected here. How did they detect this, and are the water systems safe?
Let's start with there have been no impacts to the drinking waters in affected communities nationwide, Margaret. I think that's important for viewers to understand. Only 5 of the dozen affected states have publicly acknowledged it. You'll see it on the map. But operators realized that something was wrong here when they could not access their own computer systems. Essentially, they were locked out by these malicious cyber actors. And what we know right now is that cyber attackers have been going after the industrial control systems, essentially the small computers that operate the pumps, the valves, the water flow, and the water pressure. And they've been doing that because so many of these systems are remote controlled and were under COVID, which enables them to face the internet directly. And there are just not the firewalls in place to protect these systems. In fact, many of them use default or weak passwords, essentially enabling these attackers to go right in at least one case. And this is of particular concern to the FBI. Not only did attackers enter these exposed industrial control systems, but they actually messed with something called the ladder logic, which essentially gave new instructions to the computer about how to operate this system. Now, again, we've caught this so far, but this is a real concern.
So there were instances back in 2023 when these Iranian-linked hackers were accused of accessing water systems. In July of this year, Homeland Security, which has that division, CISA, which is supposed to be protecting these things, said that there was concern about Iranian-affiliated cyber targeting across critical infrastructure. Is that the government saying Iran did this?
I think a lot of cyber experts are saying if it looks like a duck and it quacks like a duck, it's probably Iran, but there are some nuances here. This campaign, like you mentioned, resembles previous Iranian-linked campaigns, right? You have targeting exposed industrial controllers, exploiting this weak sort of authentication, a willingness, by the way, to create actual disruption, Margaret. So oftentimes when we see Chinese-linked cyber attacks, Volt Typhoon, what the Chinese want is just to gain a foothold in the system and to lay quiet. Here we're seeing actual disruptions, which is part of previously the MO for Iran. That being said, these are very unsophisticated attacks. And so there are a plethora of cyber actors who could be responsible for this, including those who might be trying to mimic Iran. This is why it's very important to not just look at the behavioral similarities, but for the FBI and DHS to use intelligence and to attribute these publicly, which could take weeks or months in many cases because the forensic systems are just not good in these water municipalities. Last thing here, how we respond in and of itself is a signal, right? If a nation state can degrade water systems in roughly a dozen states and the response is just a shrug and an advisory, that is an invitation to foreign adversaries in the future to take a hit on U.S. critical infrastructure and expect no consequences.
Such a key point. Nicole Sganga, thank you for your reporting. We'll be right back. That's it for us today. Thank you all for watching. Until next week. For Face the Nation, I'm Margaret Brennan.